Most people don't know which material to choose when restoring their teeth because some clinics insist on metal ceramics while others recommend zirconia. And no one talks about the most important thing: what will happen to your teeth in 5, 10 or 20 years. But you can forget about dental problems for many years if you choose the right material that suits you personally. If you make the wrong choice between metal ceramics and zirconia, over time your gum will recede, it will drop down, a bluish tint will appear, the metal will start to show through, and after a couple more years you'll develop a metallic taste in your mouth. But how do you know which one is right for you? Why can one material ruin your smile while another can preserve it for many years? And how can you avoid making the wrong choice? In this video, we'll go over all the details that will help you make the right decision. Let's figure it out together so your smile stays beautiful and your visits to the dentist remain rare. Simply put, a crown is an artificial cap that is placed over a specially prepared natural tooth or a prepared implant. In terms of shape and structure, it's hard to tell it apart from a real tooth. There are several types of crowns: plastic crowns, metal ceramic crowns, and zirconia crowns. In this video, we'll focus on the most common ones: metal ceramic crowns and zirconia crowns. Essentially, what we have here is a metallic cap or covering, which is then carefully and thoroughly covered with a protective outer layer of ceramic material. That is, glaze is applied in a special furnace at a specific temperature. It is baked, and we get a metal ceramic crown. So the base of a metal ceramic crown is metal, which is coated with ceramic on top. The advantages of a metal ceramic crown are its strength, durability, and the ability to vary the color. That is, a dental technician in the lab can practically paint a metal ceramic crown like an artist, and it's always possible to match even the most complex shade, blending from a darker color at the gum line to a lighter shade at the edge of the tooth. That's why metal ceramic crowns have a rather, let's say, wide color range or palette, which allows us to maintain a very natural shade that is indistinguishable from real teeth. Also, of course, another advantage is the price of a metal ceramic crown. The approximate cost of a metal ceramic crown ranges from 12 to 20,000 rubles. Now let's talk about the disadvantages of metal ceramic crowns. The main disadvantage is, of course, light transmittance. In other words, our healthy teeth allow light to pass through. Unfortunately, this is not the case with metal ceramic crowns. So if we shine a light source on the tooth, our tooth will not let the light through. And this, of course, let's say, affects the aesthetics and can sometimes impact how natural it looks. Another drawback of metal ceramic crowns is their tendency to chip. That is, the ceramic layer can chip off, and the repairability of such a tooth is practically reduced to a minimum. So as soon as we chip this ceramic surface and the metal base underneath becomes visible, in most cases the crown will have to be completely replaced. Another disadvantage of a metal ceramic crown is the so-called metal margin, which most often appears after a certain period of use. That is, when the crown is installed, the prosthodontist always tucks it under the gum. At first, the gum is right up against the crown, so nothing is visible. But over time, unfortunately, the gum recedes or shrinks for various reasons, and a dark line appears. So what we see is precisely this metal base of the metal ceramic crown. And of course, this also affects aesthetics, and to be honest, it really bothers patients from an aesthetic point of view. Another disadvantage is the preparation or grinding down of the teeth. As we know, in order to fit a crown, the tooth needs to be ground down and prepared. With a metal ceramic crown, since the crown itself is quite thick in volume because there's metal, and then we need to apply a layer of ceramic mass on top, the crown ends up looking rather large and bulky. Accordingly, the tooth needs to be ground down more, and most often, for a metal ceramic crown, the tooth is ground down quite a lot, leaving just little stumps or small projections, as we might call them, onto which the crown is then placed.
I need to replace my crown. Can you tell me how this will be done? Will they grind down my tooth again, or just change something on this crown? Or will they remove this crown and put on a new one?
As for the process of replacing a crown, yes, first and foremost, as I mentioned, this is of course decided by the prosthodontist during one of your checkups when you come in. And if we are talking about replacement, then naturally an entirely new crown is made. Most often the tooth is not ground down again because it has already been shaped and prepared. It might be treated a little with a special solution or agents, but the tooth itself is not ground down again. A new crown is made. And most often this new crown is slightly longer than the previous one, so that, so to speak, it fits under the gum again. In some cases, we can even perform what is called mucogingival plastic surgery. When there is not enough gum tissue, we can add gum tissue so that we once again have this cuff, so that the crown is hidden under the gum. The lifespan of a metal ceramic crown ranges from 10 to 15 years. With proper care and regular visits to your dentist, this crown can actually last quite a long time. The main task here is to monitor what is happening with the gum, to make sure it does not recede, and to ensure that nothing from the oral cavity seeps under the crown and damages our tooth, the abutment tooth on which the crown is placed. In my practice, I often encounter the objection when a patient says, "I've had these crowns my whole life and nothing has ever happened to me," or "My wife or my father or my grandfather had them their whole lives and everything was fine." In reality, that's not quite true. It's a bit distorted. It's distorted by the fact that most often, if a patient has never replaced them or sought help, it seems like everything is fine with the crowns. An odor develops. Of course, the patient notices it, but assumes everything is all right. In reality, when we remove such a crown, we see all the consequences that have occurred underneath it. This is extensive tooth destruction. These teeth are almost ready for extraction.
What will happen to my crown in 10 or 15 years? And accordingly to my teeth? Will I have to have them removed?
Well, actually, it's not quite like that. A metal ceramic crown, as I mentioned, over time may simply develop first and foremost this black line. That is, unfortunately, everyone's gums recede for various reasons. There are many causes. So the first thing is, of course, gum recession. And that's when we see this line. So it seems as if nothing has happened to the crown yet. It's still in place just as it was before. The teeth are still functioning as they were. But we can already see these kinds of warning signs that while for now this may only bother the patient aesthetically, in the future, if this isn't monitored and you don't visit the dentist in time, then right in these gaps, let's say between the black line and our gum, oral fluids gradually start to seep in. And the tooth under the crown, precisely in this spot, begins to, let's say, deteriorate or decay. The main goal is to make sure that our supporting tooth does not get destroyed, and this is only possible thanks to the gum, because it is the gum that creates this cuff for us, which hugs our crown and prevents anything from seeping in.
At what point is it best for me to see a doctor? After a certain period of time, or as soon as I notice any changes with this crown?
Well, as I already mentioned, it's actually very simple. We have clear time frames. So if you visit your dentist once every 6 months, not only can these consequences be prevented, but most importantly, if they do appear, they can be detected and corrected in time. A zirconia crown is a type of ceramic crown made from special zirconium dioxide. As for the advantages of a zirconia crown, well, it offers superior aesthetics. Since the crown is metal-free, that is, zirconia is not a metal crown, it has a very high light transmitting ability, meaning it is translucent, and under natural or sunlight, your smile looks much more natural and lifelike. Undoubtedly, strength is also a major advantage of a zirconia crown.
Which is stronger? Metal, ceramic, or zirconia?
Well, actually, it's probably not quite right to put the question that way, because these are practically identical materials in terms of strength. Or, to be more precise, they might differ somewhat in strength, but the kind of force our jaws can exert, no matter how hard we try to clench our jaws, we simply won't be able to exceed the strength limit of either a metal ceramic crown or a zirconia crown. So it's better not to frame the question that way. But if we talk about chipping, for example, when it comes to metal ceramics, as we mentioned earlier, metal ceramic crowns are definitely more prone to chipping, and as a result, their repairability or the aesthetic aspect suffers significantly. So for example, if you happen to bite down on something with a zirconia crown and chip it, it will be noticeable but not as much, and it's not as aesthetically critical. But if we're talking about metal ceramics and you bite into something hard and chip it, the damage is immediately visible. It's a black line, a black streak right on the tooth, and aesthetically it will really bother you. And almost immediately the patient comes to the dentist to have it fixed. Another advantage is that your own tooth needs to be prepared or ground down much less than, for example, with metal ceramic crowns. It varies from case to case, but in any situation this can be considered an advantage. Another advantage of zirconia crowns is what's called precision. That is, nowadays these crowns are milled on a special machine to a fraction of a micron. A special digital impression is taken with a digital scanner and sent directly to print. All of this is done by a robot. And of course, the precision increases significantly because now it's handled, so to speak, by artificial intelligence or a robot. Another relative advantage is that this type of zirconia crown is extremely popular. In other words, nowadays it's practically everywhere. Zirconia, zirconia, and more zirconia in every dental clinic. Well, as for the relative disadvantages, of course, the price can be mentioned. The price, undoubtedly, if you compare it to a metal ceramic crown, the cost of zirconia is definitely higher. But again, the price is more than justified by the advantages that zirconia offers. By and large, there really aren't any significant drawbacks to zirconia. The only thing is that sometimes, for example, if a patient already has metal ceramic teeth on the lower jaw, then most often we will also make metal ceramic teeth for them on the upper jaw. The price of a zirconia crown ranges from 15 to 30,000 rubles. The lifespan of a zirconia crown ranges from 10 to 20 years. As I mentioned earlier, if you visit your dentist regularly and properly, then of course the lifespan can be extended and increased.
So I asked when metal ceramic crowns need to be replaced. When there are chips, I understand that now. But when should zirconia crowns be replaced? In what cases?
With a zirconia crown, gum recession or the process of gum loss, when it recedes or lowers, is just as inevitable as it is with metal ceramic crowns. Therefore, the schedule for preventive visits remains the same. That is, every 6 months, and only an orthopedic doctor can determine this. So with zirconia, the big advantage is that when our gums recede, we won't see that black line. We won't notice it. In other words, it won't be visible. That's the big advantage, but at the same time, it's also a bit deceptive. That is, the teeth under the crown, whether it's a zirconia crown or a metal ceramic crown, will be destroyed in exactly the same way. That's why you need to take care of your teeth just as carefully. If you ask me what I would personally choose, I always say, this is my personal subjective opinion. Of course, I would go with zirconia. Not only because, as I said, it's a modern material, but also because it has quite a few advantages. And for me personally, zirconia would be the more preferable option. Dear friends, I would still like to emphasize that when it comes to choosing between a metal ceramic crown or a zirconia crown, the choice is entirely up to you. The very first thing you need to do is, of course, come in for a consultation with a doctor and together with the doctor decide which alternatives the doctor will offer you. That's why personally I don't like these polarities. Whether something is bad or good, yes or no, that's for you or the specialist you trust to decide. Which option do you think is best? Write your thoughts in the comments. If you want to know how to avoid harming your teeth, then subscribe to our channel. Take care of yourself and your loved ones.